telling this story. These are the results of some studies that we recently published, which compares the arterial pressure and cerebral blood flow in POTS shown by the gray line and control subjects. The arrows here depict the beginning of and the end of a tilt. Now, use your imagination. This is very similar to what I showed you earlier for the blood pressure changes that are measured with the imposition of a tilt. In the control, there's actually a little rise, and then when the table goes down, their blood pressure comes back to normal. Notice, however, that in this particular individual, this is the recording from one individual, this is what we refer to as a representative graph, that their blood pressure tends to go down and it comes back up. Again, this individual did not faint. The more dramatic change can be appreciated while looking at the cerebral blood flow tracing. At the imposition of the tilt, there is in the control a gradual decrease and an increase with the return to supine of the cerebral blood flow velocity. However, look at the greater drop in the cerebral blood flow velocity shown here for the individual with POTS. Now, that was the overall change, and this slide shows some other rather interesting control aspects of the relationship between blood pressure, shown here as MAP, the mean arterial pressure, and cerebral blood flow. Notice here that this is a control subject who was lying down at the time and then tilted. And this is 1 minute after the imposition of the tilt. Here you can see that there's a rhythmic change in the blood pressure, which is what everybody experiences. And notice that the cerebral blood flow is relatively unchanged. Notice, too, that once the individual is tilted, there is a decrease in what's known as the pulse pressure. That is the difference between the systolic and the diastolic. But there are still these small oscillations and changes in blood pressure. But notice that the cerebral blood flow, by and large, remains steady. In contrast to the control, notice most dramatically that the cerebral blood flow goes from being relatively steady while supine to very, very wavy, and actually seems to be in concert with the changes in blood pressure, showing that there is a loss of control. There is a loss of control between, rather, there is a synchronization of changes in the cerebral blood flow with that of blood pressure. And earlier, what I showed you was that the controls with tilt, there's a change in blood pressure of about 10%, but in those individuals with POTS, that actually goes up to about 20%. Now, we just published a paper recently where we looked at individuals who faint, syncopal patients, to see if we can understand whether or not the changes that we see in POTS patients and controls regarding the regulation of their cerebral blood flow relative to their blood pressure, how that compares to people who faint. And this is a recording of pressure, arterial blood pressure, in an individual at baseline, early on after the tilt table goes up, and you can see that their blood pressure dribbles down, 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 and boom, this is the time of faint. In order for us to be able to compare controls to the fainting individuals, we artificially imposed the same timeline on our analysis of their blood pressure and their cerebral blood flow, so that we could say, for instance, at baseline, it looked like this in the syncopal, it looked like this in control. Obviously, since this control subject did not faint, we wanted to use the same time points following the tilt to make a valid comparison. And what we showed here is that in subjects who faint, look at how dramatically increased the change in their cerebral blood flow velocity is, and this is their diastolic. As all of you know, blood pressure is the high number, the low number, the systolic and the diastolic. We can also measure brain blood flow velocity in terms of how much blood is flowing at the peak, systole and diastole, and it just gives us an additional look. But the overall response to tilt is a dramatically increased drop in the brain blood flow in these syncopal subjects. I spoke earlier about alterations in blood volume, and this was a very interesting paper that was recently published, which shows that there is a dramatic difference in the blood volume of subjects with chronic fatigue. What made this study very, very interesting was that the authors compared chronic fatigue subjects to sedentary controls who exhibited similar activity patterns to fatigued individuals, and showed that while there was somewhat of a reduction of blood volume in sedentary controls, subjects with chronic fatigue syndrome had a significantly increased decrease, or had a significant decrease in blood volume levels. This is a comparison of our subjects, which show that in chronic fatigue subjects, 3 of the 19 subjects that we studied with chronic fatigue had what's known as hypovolemia, or decreased blood volume that had the characteristics of low blood cell volume and low plasma volume as well. That's the end of the information that I want to show you. I can summarize by saying that our perspective on the study of chronic fatigue is an integrative approach, which seeks to look at those factors which can control local and systemic blood flow. Once we have a better understanding of that, we can look to make predictions about why some of the symptoms occur in chronic fatigue. Some of the work that we're currently doing, as I said, involves the studying the synchronization between brain blood flow and the control of blood pressure. We are endeavoring now to look at the local oxygenation levels in an attempt to see whether or not we can understand why individuals with chronic fatigue have this brain fog, certain neurocognitive deficits. We're also studying some aspects of neurocognition in our laboratory, in addition to the host of cardiovascular measurements that we make. I know I've flooded all of you with a tremendous amount of information. As I said, we employ an integrative approach. We generate lots of information. A large part of the challenge that faces us is knowing what to look at, how to look at it, but we're fairly satisfied that we're looking at the right cohort of subjects, that the information that we're gleaning will hopefully in the future be useful and we're chipping away. I want to end by saying that I, as a researcher, and in particular one who is funded by the Chronic Fatigue Association, very much appreciate everybody's input, their participation, their contributions, both intellectual and financial, to figure out what's going on with many of these individuals. I've pretty much exhausted what I want to say, at least for this afternoon's presentation, and I can I'd be happy to answer any questions and turn the controls back to Kim to solicit some questions.